Hey guys, my name is Garrett McLaughlin. I am here with Dr. Jesse Riley, who's going to really help me provide more value for my clients and really show them how to reduce the incidence or pain at the lower back, okay, with extension-based back pain. So, Dr. Riley.
Hey, how you doing, guys? I'm Dr. Riley. I'm at Resilient Health and Performance in Brentwood. I'm a functional movement specialist, so what we do is we take a look at fundamental movements and apply that to the root cause of why you're coming in with your pain. So like Garrett said, we're going to take a look at extension-based back pain and kind of work on exercise and cues and progressions for that. So Garrett, take it away. Awesome.
All right, so here in this next sequence, Dr. Riley is going to run us through a simple progression on how to stay out of or help eliminate or reduce the incidence of back pain. So what do you typically start with as far as cueing for someone that has back pain?
So a lot of that has to relate back to if extension is the cause of your pain, then we have to go back to something that isn't your pain, ideally. So that's going to be a little bit more flexion-based stuff. So we're going to take a look at some exercises with that.
All right, so what we're going to do is we're going to make Garrett work a little harder today. So I'm going to be doing the cueing. We're going to start with a progression of kind of a plank variation. So Garrett, go ahead and get on all fours for us. So one big thing here is we're going to go what we call quadruped position, but I'm going to have him go onto his elbows for us, okay? So what I need him to do now is he's going to take his feet, lift those up in the air for me, put the heels together for me. And then I need a little bit of an arch up towards the ceiling here. Perfect. So what I need him to do now is he's going to act like he's trying to push his heels together as hard as he can. And then the next big cue here is this. Keep this arched up, but he's going to try to draw his elbows towards his knees as hard as he can. Okay? Good, and hold that position. Excellent. If you're shaking, then you're doing it right. Okay, so the next one, Garrett, all I need you to do, go ahead and go into what we consider a plank position. So we're going to go knees extended upwards. That's perfect. Big cue here is we're going to have him to go butt cheeks squeeze together. And same thing here, trying to draw those elbows towards our feet as hard as we can. Good, and you notice here there's no dipping here, okay? Excellent. So we say typically you start with kind of a low amount of time, 10 seconds or so, kind of go higher reps, and then as you get better at it, you increase the time. All right, so the next progression or exercise that we're going to work on with Garrett is going to be kind of a sit-up progression. So Garrett, actually what we're going to have you do first is go ahead and go on your back, and we'll go knees bent. The biggest thing with these is I see a lot of time with sit-ups or anything like that, people have this extension moment right before they come up. So I always suggest if that is a little bit too difficult here to maybe use like a band for assistance, and you can have it kind of at the opposite end to help you out. Today, however, what we're going to do, the first progression, is we're going to have Garrett go into what we call a 90-90 position. So we're going to have his knees all the way up here like so. And then I'm going to have you take your hands, put them right on your knees. I need him to do two things for me. Hands into the knees as hard as he can, but the big cue is this. I need his knees to meet that pressure, okay? Go for it, Garrett. Now sometimes some people do have a little bit of extension here, so what I usually say, take this, drop it to the ground as hard as you can, okay? Good, same kind of thing. If we're shaking, that's a good stability cue for us, okay? All right, so the next one we're gonna do with you, Garrett, we're gonna do kind of similar position, except this time what I need you to do is you're gonna have hands extended outside your knees, okay? So lift the knees up again, and then take your arms and put them right there for me. All right, now I need you to press your knees against your arms, and then as you're doing that, I want you to try to draw your knees towards you. Okay, so go ahead and push and start drawing these towards your chest. Good. Always being really meticulous for detail here, slow and steady. Excellent. So the first one obviously is a little bit more for time. So again, usually 10 seconds starting out with maybe higher reps. And then as you get better at it, extend the time up. This one's a little bit more rep based. So maybe we start out with about 10 and then work our way up from there as well.
All right, guys, so thank you for watching this video today. Special thanks for Dr. Riley. I just want to ask you, what type of client needs these type of exercises?
Yeah, excellent question. I would say extension-based back pain is like one of the most common things that I see day to day. So one of the big things that I would say is starting on just a very introductory level is take a look at your programming, okay? Whatever you're doing at the gym. And that's where Garrett comes in so handy because he's an expert at the programming side of things. So asking guys like him, okay? And after we work through that, if we're still experiencing pain, then you need to seek out a functional movement specialist in your area. So look at Garrett's information below at the end of the video, and he can get you set up with someone who's qualified to do so.
All right, guys, thanks for checking out the video today. Again, shoot me a message, let me know. I can definitely connect you with Dr. Riley if you have any questions or concerns. We hope you enjoyed the video and have a great day.